teenager just collapsed in the middle of school. No heartbeat, no oxygen. You have less than 4 minutes before their brain starts dying. This isn't a movie. This is what real doctors actually do when everything is on the line. And what you're about to see is the truth and how lives are saved. When a patient crashes, no pulse, not breathing, there is no panic, just movement. The team has trained for this moment thousands of times. One person starts chest compressions, deep, fast, 100 to 120 per minute. Another checks the airways, making sure nothing is blocking it. Someone grabs a defibrillator, and someone else is calling for help. Code blue, room 3, stat. They're trying to restart the heart, but at the same time, they're asking, why did this happen? Was it cardiac arrest? A hidden condition? An allergic reaction? A drug overdose? At this point, the patient has no oxygenated blood going to the brain. Every second increases the chance of permanent damage. A doctor administers epinephrine, a drug that forces the heart to contract harder and faster. Another prepares the shock with a defibrillator, but only if it's in the right rhythm. You don't shock a flatline. That's TV drama, not medicine. Flatline means no electricity, which means there's nothing to shock. Real life is more complicated than fiction. Meanwhile, someone is timing everything. When meds were given, how long CPR has been going, and when the last pulse check was. It's clinical, coordinated, and fast. Here's what most people don't realize. The team isn't just fighting biology, they're fighting time. And they're doing it while juggling other patients, family members crying, alarms going off, all in the space and the size of a bedroom. Sometimes the patient wakes up, sometimes they don't. But the team doesn't stop. They push for every single chance. When resuscitation fails, the room gets quiet. The machines go still. A nurse removes the pads from the chest. A doctor calls time of death, and then that same team walks into the next room, puts on a smile, and cares for someone else. Because the ER doesn't stop. And medicine is about doing your best every time, whether the outcome is perfect or heartbreaking. Real medicine is messy. It's fast, it's exhausting, but it's also heroic. And if you wanted to be a person who runs towards the chaos, not away from it, then emergency medicine might be for you. Comment below. Would you want to be the one making decisions in that moment? Smash the like button if this gave you a new respect for what happens behind those hospital doors. And finally, if you want more real medicine, no drama, just the truth, hit the subscribe button. We're breaking it all down, one life-saving story at a time.